Hi, my name is Talha Malik. I am an IBD doctor in the Division of Gastroenterology and Hepatology at Mayo Clinic in Arizona. And today I did a 20 to 25-minute talk about inflammatory bowel diseases. And my talk was geared towards an internal medicine, family medicine audience. What I wanted to do, especially because all of us, including GIs, IBD doctors, have a background in internal medicine, and that's our initial training. I wanted to kind of see if I could talk to my colleagues who are still practicing internal medicine in terms of what would be relevant to their practice in terms of IBD, which is inflammatory bowel disease. So I wanted to kind of see what would I want to know if I was seeing somebody with a non-IBD chronic disease such as hypertension, diabetes. Well, I think what I would want to know, at least in practice, would be I would want to know a little bit about the disease. How does one define the disease? What is the pathogenesis of the disease? A little bit about the epidemiology of Crohn's or UC as an internal medicine doctor. Then I would want to know what is it in terms of red flags that one could present with in clinic that would suggest a possible or probable diagnosis of Crohn's or UC that I need to know about. For example, what do they have abdominal pain? How long does that abdominal pain have to last? What is the family history that I need to look for? What are the risk factors that I need to know? And things like that. So after epidemiology and somewhat risk factors of this disease, I wanted to present diagnosis, for example, clinical features, what are the tests that I need to do, what are the images or diagnostic tests in terms of radiological tests that I need to do, and then what is the role of endoscopy in patients that I need to kind of look for Crohn's in. And then finally, which I think is also essential, is the approach to management. How does one classify disease when it comes to UC or Crohn's? How do I categorize disease activity? Which person is doing well? Which person is not doing well? Who is severely ill and needs to be sent to the ER or to get admitted rather than just me calling an IBD doctor and say, hey, can you see this person in about a week or two? For that approach, I talked about, what is the well-established classification of this disease, how does one grade severity of this disease, and then how does one approach management in terms of medical regimens based on the best evidence out there. And I kind of felt that if I was an internal medicine doctor still and somebody with IBD expertise wanted to talk to me about that condition, I would have wanted them to have that same approach, with beginning from epidemiology, going to diagnosis, and then giving me a summary of how to approach management and how to know which person I could get things going on and which person I need to get to the IBD doctor and which person I need to get to the hospital. And that was kind of the summary that I thought was the gist of my talk today.